AlayaCare empowers care agencies around the world. And so we see trends in various markets. And what I do every year is step back, look at the big trends that are shifting the markets we're in, be those technology trends or market trends, and I make some predictions for the next year. So firstly, I think we are going to see less siloed care being delivered this next year, and a continued shift to a more holistic model of care. So what that'll mean is the lines between clinical and non-clinical care will become increasingly blurred, and I think we're gonna see more of a acceptance of the fact that even non-clinical interventions can have meaningful impact on clinical outcomes. We see that in the U.S. market in the form of the rise of the home care benefit and Medicare Advantage plans. We're also seeing MCOs, managed care organizations, that are shifting towards more risk-oriented contracts and are looking to share risk with providers in the community, like you all running your businesses online. So another impact that COVID is going to have, or continue to have, I think, is a shift of care setting to the home. So the pandemic has shown very clearly that home is not only the preferred setting for most patients, but is also the safest setting. And so regardless of the precautions that are taken in a congregate care setting, I think there's an increasing awareness that infection risks are just lower in the home, number one. Number two, that telehealth interventions can be a very important part of the mix in terms of achieving those care outcomes, and of course that those are fully safe. And then finally, that the patient journey with mobile technology and remote monitoring and new emerging tools, that journey can be increasingly realized in the patient zone. So the third prediction is that home healthcare will shift from being technology enabled to being technology centric. And so what do I mean by that? I mean, firstly, that all your coordination and back office type activities can be realized as efficiently from home with good access to a web app. It means that care managers are able to handle an increasing percentage of their supervisory tasks via telehealth. It means that the brand experience that you have, not just for your care workers, but care seekers as well, is increasingly dominated by the digital touch points into your business. It means that the recruiting and onboarding experience has and will continue to shift more and more to the cloud. And it means that patient engagement tools like the client and family portals are going to continue to be adopted at a higher level than ever before historically. So the fourth prediction is that caregiving as a career will become increasingly important in our society. So the ferocious demand for manpower that existed in the pre-pandemic economy and unfortunately has reduced a little bit with really broad swaths of the service economy moving to Amazon and to the more digital touch points. And even pre-pandemic, caregiver was one of the fastest growing jobs. Now it's going to be increasingly fast growing and increasingly valuable as a source of employment as other types of service jobs flip to the cloud. Also, as safety issues around COVID become increasingly under control, and of course, our care workers are going to be at the front of the line for the upcoming vaccines. We think it's going to be an increasingly safe job. It'll also be a job that is increasingly valued by our society. So we didn't necessarily see people flying flags and honking in support of care workers in 2019 the way we did in the midst of this global pandemic. And then finally, there's a lot of discussion around the gig economy and how that impacts workers' rights. I think what we'll see is that in this profession, we can provide not just stable employment, but high quality employment. And so I think the just increasing the flexibility and stability of these jobs for the gig workers that we employ, that's going to be a major trend. In 2021, I think we're going to get off our back foot as an industry and onto our front foot. So we spent a lot of this year that was reacting to the world. The next year is going to be about maximizing the opportunity that this tragic pandemic has created. So that means getting out to our referral sources, to the health systems, to the payers, demonstrating what can be done in a community setting. And it also means being very proactive with our labor forces and making sure we're really providing a great high quality employment experience with stable income and benefits. And so I think that's what 2020